was about 6 months pregnant when I graduated nursing school. I needed to study and pass NCLEX. NCLEX was the one thing between me being a graduate nurse and me being a registered nurse where I could practice as a nurse. I needed a game plan, so I created a schedule for myself, and it works. If you want to know how I studied in 5 weeks and passed NCLEX the first time with 76 questions, then keep watching. Hello, welcome to Nurse Life. If you are new here, welcome. If you are returning, thank you so much for coming. I do appreciate all of your time and you being here. If you have not subscribed to my channel, please go ahead and subscribe and hit the notification bell so you don't miss any updates from me. This video, I am here to tell you everything that I did to help me be successful when I first took my NCLEX. So the first thing I did was create a schedule. I went to the library Monday through Friday, 10 to 2. I had a 2-year-old at the time. I was about 6 months pregnant at the time. I needed that time to be a student, as well as deal with the little distraction like eating frequently, getting up frequently. So for you, that could be long. But think about what works for you. It could be 2 hours. It could be 1 hour. Just make it count. Get away from every distractor. Turn your phone's face down. Turn it off if you have to. And just invest your time. It will pay off. Trust me. Number 2, start doing the time that you are most alert and can retain information. For me, I figured that when I first got in college, I registered for classes. In the one class that I registered for that started after 3, I ended up dropping. Because by that time, I was tired. I didn't want to go to class. I just wanted to relax. So I did not sign up for evening classes. That wasn't my thing. I learned best during the morning hours and I stuck to it. Figure out what time works best for you. Number 3, start your study session with answering practice questions, then remediate. What that does, it helps you identify areas of content that you need to read more about. You could answer a question and get it right, not necessarily knowing the content, by just making an educated guess. But when you are studying, you want to make sure that you are learning as much content as possible so that when question comes in different ways, you understand and know how to answer. So remediation is key. And answering questions first just help you identify those areas that you need to spend more time reading about. It's all about time management. Number 4, increase your practice question as you get closer to your NCLEX date. Studying for NCLEX is almost like preparing for a marathon. Those marathon runners don't just get up and run 2-3 miles. I believe they practice for that. I remember in school they said you could take up to 200 and I believe 40 or 75, I'm not quite sure, but over 200 questions. Sitting that long and reading that number of questions is a lot. So you have to prepare yourself. You have to prepare yourself physically to sit, and you have to prepare your brain mentally to be awake as you do this. So increase those practice questions as you get closer to your test day. It will help you. You don't know the number of questions you're going to take. Be prepared. Number 5, use fewer resources. There are tons of resources out there. My school had Kaplan embedded into our nursing program as our prep course. We took an assessment test every semester. Kaplan had their benchmark, and I was one of those students who never got the benchmark. Reading through Kaplan book was hard for me. The book was boring. It was such a dry read that I found myself not interested at all. But I had to figure out a way to study. I saw one of my friends reading Saunders' book, and I'll put the information in the description box below. That book was just so colorful, and it's like the words was jumping at you. I asked her about it. I got me a copy and I started to read that book and study. Okay, so I only had Kaplan because my school suggested it. Well, not even suggestion. My school make it available. I pay for it through my tuition, and I didn't have a choice. But Saunders was the one that I really focused on. Number 6, identify stressors in your life and avoid them. Hey, we all have things that makes us feel anxious. What makes you feel overwhelmed? What makes you feel anxious? And I'm talking about things that are in your control. I'm not talking about things that you cannot control. All of my friends by senior years, my classmates, they had all interviewed for jobs. I had to say out loud to myself that I don't need to apply for nursing job right now. I need to pass NCLEX. For me, I knew that applying for a nursing job and having an offer will make me feel overwhelmed, will stress me out, will make me anxious. For you, it could be a motivation for you to study. That was in my case. So I waited. At the end of the day, I got a job with one of the hospitals that I did my clinical at. When I left that job, I went to another hospital that I did my clinical at. I took my test July 7th and I got my first job August there. So there was not a long wait period. Identify what stressed you out. Another thing that I also did, I never told anyone my test date. During my study time, people would ask me, when are you taking your test? Are you studying? I'm like, yes, I am preparing. I will take it when I'm ready. That was my answer. And it's so natural for us to ask people and for people to come up to you and ask your family member, wanting to know what you're doing, how you're doing. They will do that. It is a natural response. But just focus on you and remember what stresses you out. Maybe telling someone when you're going to take the test will be a motivation for you to study and use your time wisely. If that's the case, do that. But if you're someone like myself who was stressed or feel overwhelmed and worried about, am I going to do well while you are preparing, then take that extra stress off yourself and don't say anything. Number 7, pharmacology is huge. Okay, those medications have tons of names. They are in classes. One meds has 2 different names. How can you study them? I studied the class of medication and look at their side effects. Each class of medication has a common side effects. There will be 1 or 2. I know in school, among the antibiotics, while their common side effects was diarrhea, there was I think one class or so that had a different side effects. Identify that, write it out and focus on it, so that when you are answering questions about a medication in a group or in a certain class, you know the common side effects of that class as well as the one that is different within that class. Just signaling things out that way really help you remember. I did that and it works. For lab values, I'm going to tell you this. I created a poster. Yes, I created a poster. I had that poster up in my bedroom. When I was going to bed, I look at it. When I wake up in the morning, it's staring at me. My lab values were right there. When you are studying the lab values, study the symptoms associated with abnormal labs, as well as what you can do to fix it. The presentation, how do patients present when they have low potassium? What do you expect to see? What are they coming in with? What are the complaints? And once you identify that complaint, what are the interventions? What are some interventions that you can do? And always remember on the NCLEX, those questions that asks you as a nurse and give you the opportunity to be a nurse that's applying an intervention. You want to make sure that you're reading those questions, answers, and it making sense. NCLEX is a test for registered nurses. So the answers that say call the doctor, you should think about your other options. Is that the only option, calling the doctor? Because, for example, if a patient is having an allergic reaction, yes, you will notify the doctor, yes, you will call the doctor, but your first step will be stop the medication or whatever they are reacting to, take it away from them. Then call the doctor. So you can't say, I'm calling the doctor first, because you know what? By the time you get back to them, they could be dead. So no, you stop the medication or take whatever is causing them to react, take it away, then notify the doctor. So always be thinking in terms of intervention. What is it that you, the nurse at the bedside, what are the answers that giving you the opportunity to be a nurse at the bedside? And remember, this is the one thing between you as a graduate nurse and you as a registered nurse. Invest your time. Use your time wisely. Don't take a break after school. Don't take a break. You're not done yet. You are done when you pass your NCLEX. You can take all the break after you pass your NCLEX. You don't even have to start a job if you don't want to. You can even tell your employer when you interview with them that you have a vacation and you don't want to start right away. They will give you that time. Trust me, they will give you that time. So please study for your NCLEX. Take your NCLEX before you go on vacation. You have worked so hard for this and you will do great. Thank you for watching, and I hope that you have a good new year.